So how do you measure someone's body temperature? We have 6 common ways in medicine that we will measure body temperature. The first is via the axilla. So this is something where you're putting a temperature probe in someone's armpit. The nice thing about it, it's very easy to do. All you have to have is the surface skin available. The downside of it is that it's not very accurate. So it is simply going to be used very sparingly and only when you don't have access to another site. Blood temperature is another one that we can measure. This one is very accurate, but the only problem is you need to have an indwelling catheter in place. So this is usually only done in emergency medicine conditions or in the ICU or in clinical care unit. Esophageal temperature is a very accurate way to measure body temperature, and this is done by inserting a temperature probe up the nose and swallowed down to the height of the aorta. So you need to have someone who is awake and fairly motivated to be able to get the temperature probe in that location. But it is very accurate if it can be obtained. Oral temperature is done quite often, and this is done in many clinical situations. So this is a temperature probe that's placed in the sublingual sulcus, which is just below the tongue. And the only downside for this is it needs to have low ventilation at these time points, because the more breathing rate that you have, the more you can cool off the oral tissues and therefore decrease body temperature. The other thing to think about is that it almost always results in a lower body temperature than you would get from some of the other mechanisms, such as blood temperature or esophageal temperature. It's usually only about 0.4 degrees less. And that's something to keep in mind when you're trying to determine if someone has a fever. Rectal temperature is another way you can measure body temperature, and this is oftentimes done in children. And this, for a rectal temperature, is usually a thermometer that is used. And for this, the only downside with it is that the temperature changes that occur in the rectum are usually slower than the temperature changes that occur in the blood or in the esophagus. And that's because there's less amount of blood flow in the GI system. The final temperature measurement that people oftentimes use is a tympanic membrane temperature. So this involves an infrared thermometer that you try to bounce off the tympanic membrane. And this, in theory, could be accurate. The problem is that it's very hard to bounce this wave right off the tympanic membrane. Usually you bounce it off the external auditory meatus or the internal auditory meatus, and therefore you don't exactly get tympanic membrane temperature. And if this is the case, then that temperature measurement can be inaccurate. Also, even if you get an accurate temperature measurement or bounce it off the tympanic membrane, it usually is a little bit lower than even oral temperature, and so that needs to be taken into account. These are our 6 ways to measure internal temperature. And again, if available, the blood is the best, followed by esophageal. And then if you're okay with stable temperatures, rectal works really well. And then oral temperature, followed by tympanic membrane temperature. And finally, if it's the only thing available, axillary temperature. Now, when we classify someone at different body temperatures, we need to think about what is a normal body temperature. So we need to account for a diurnal variation of around a half a degree from 37, so that'd be 36.5 to 37.5. We also, if they're a woman of reproductive years, we need to also change what is a normal body temperature depending upon which phase of their menstrual cycle the woman is in. So normally we think of body temperature as somewhere between 36.5 and 37.5 centigrade. If someone has a low-grade fever, we usually classify that as 37.8 to 38.3. A high-grade temperature is something between 39.4 to 40 degrees centigrade. Finally, hyperpyrexia is a very dangerous condition which you could even involve some neurological damage. This is with temperatures above 41.1 degrees centigrade.